Hey everyone, it's Dr. Christy. I want to share with you a few of the symptoms that I've seen in my female clients over the years with regard to stress. So the impact of chronic emotional stress, whether it's an actual threat to your body, to your life, or a perceived stress, something that has not happened and may or may not happen, the body does not know the difference. So with chronic stress, there's a surge or a flood of cortisol, epinephrine, other hormones, other neurotransmitters that are secreted in response to this actual threat or perceived threat. So with regard to the female reproductive system and your female organs, your body is incredibly sensitive to the hormones of stress. It's very, very sensitive. It's adversely affected in a way that I think surprises a lot of women. And so some of the things that I've heard, that I've seen, that I've witnessed in my female clients, if you're still having a period, then a lot of the symptoms would be heavier bleeding, more severe PMS symptoms, menstrual cramping, more achiness, more fatigue, irregular bleeding where it's either early, it's late, mid-cycle spotting, skipping periods altogether, headaches, chronic pain, lots of other flare-ups with your skin, hair loss, because of the chronic stress. And chronic stress for somebody could be a month. Chronic stress could be several months to several years to sometimes decades. So with regard to perimenopause, which is typically between the ages of 35 and 55, your hormones, your reproductive hormones, are making this steady descent, a steady decline, or they're fluctuating. Like 1 month you're fine, normal levels, your normal level of hormones, or the next month it might be drastically low. So perimenopause is kind of this irregular swing of eventual hormone cessation that leads to menopause. So with perimenopause, your levels are already low. You add in chronic stress, the cortisol, one of the stress hormones, that further suppresses or inhibits your hormones. And that can often make perimenopausal symptoms that much more noticeable, in some cases more severe. Same thing applies for menopause. Menopause means your period has stopped completely, 12 months and beyond, and it's not coming back. So whatever symptoms you might be having with regard to perimenopause, menopause, every woman's very different, whether it's increased body heat, difficulty sleeping, weight gain, digestive complaints, skin changes, mood swings, lots of other symptoms with regard to low libido. Your symptoms are going to be that much worse with this stress, again, whether it's an actual stress to the body or a perceived threat. And my point in sharing this is that you can't get rid of stress. Stress is inevitable. It's part of life. But in many cases, you can change how you respond to stress, your reaction, or rather your response to stress, in knowing, is this something I can change? Is this something I can control? Is this something that's modifiable in some cases? What can I do to alleviate my response? How can I reframe this? What can I do with regard to my diet, exercise, meditation, mindfulness practices, breath work, sometimes walking away, sometimes letting things go and surrendering? What can you do to help lower that stress response and therefore the surge or flood of stress hormones, so that your female reproductive system, your organs, are not also in that fight or flight threatened mode, and therefore your symptoms, whether you're having a period, teen years, 20s, 30s, 40s, or you're perimenopausal or menopausal, it makes everything better. and that much easier to manage when you can manage your response to stress.